Hello, the music we've been hearing is The Trees of the Field Shall Clap Their Hands by Peter B. Allen. I hope you love it as much as I do. I think it's fabulous. So welcome to another of Ardenwood Presents webinars, Medicare and Your Care. I'm John Mitchell, and I serve as Executive Director and CEO here at Ardenwood here in San Francisco. Our webinars are designed to inspire, inform, and educate fellow Christian scientists across the country so that we all understand both the human means and spiritual truths that support us in times of need. Thanks so much for joining us today. Now, before we dive in, I want to extend a warm invitation to visit Ardenwood anytime you're in the Bay Area. You're always welcome to use our Bible Research Library and study room, or enjoy a delicious meal in our dining room, and bring a friend. And we encourage everyone to come for a rest and study visit, stay in our lovely guest room, and leave feeling refreshed and renewed. So simply call the front desk to make a reservation. You and your family are always welcome here. We also want to invite you to consider making Ardenwood your home. Our residential community is growing, and we'd love for you or someone you know to plan a complimentary come and see visit. You'll get a real feel for what it's like to live here. And please share this invitation with anyone who might be looking for their next home. Thank you. Ardenwood's purpose and mission are to support the ministry of Christian Science nursing with the expectation of full healing. We provide skilled Christian Science nursing care, offer education and training for Christian Science nurses, and host online events like this one. As a 501c3 nonprofit organization, we rely on the generosity of friends like you to sustain these programs, and we're deeply grateful for every gift, truly. Now let's turn to today's topic. Why should a Christian Scientist know about Medicare? Because it can be a real help when it comes time for paying for skilled care, the kind of care you'd otherwise receive in a hospital, which is expensive. Most of us have paid into Medicare over the years, paycheck by paycheck. Hopefully, you'll never need skilled care. But if you do, Medicare is available for those who are 65 and older. And here's an important point. There's no difference in the care you receive at Ardenwood, whether you're on Medicare or not. The care is exactly the same. And we're not endorsing Medicare per se, but we are explaining how it can help you cover your costs. Ardenwood is designated in the federal law as a religious, non-medical healthcare institution, what's called an RNHCI, or RNHCI for short. That means we're a Medicare Part A provider. Sometimes people worry that Medicare requires too much personal health information, but really, Medicare just needs to confirm that the care you received qualifies for coverage. In other words, that if you weren't here at Ardenwood, your needs would require a hospital setting. As you know, Christian Science nurses don't diagnose, and we report only general information. From many years of experience, we've found Medicare to be much less intrusive and more reliable than most insurance companies, as they call them, third-party payers. I want to emphasize the wisdom of having a care plan in place and sharing it with your family or designees. If you ever come to a Christian Science Medicare Part A facility like Ardenwood, you want your focus to be on God and healing, not on the logistics of payment. Thinking through your options ahead of time is a real support to your healing and to those who love and care for you. That's what we're about today. One last point here. Medicare can be very helpful if you ever find yourself in a care setting that isn't your first choice. That's why it's so important to have an advanced healthcare directive, or AHCD, something we'll be talking about in more detail in this presentation. Finally, the content shared today is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website in the next day or so. Replays of all our webinars are on our website, and you are always welcome to share them with family and friends. Now, let me introduce our presenters today. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's also a certified long-term care insurance strategist. Jim has talked to literally thousands of Christian scientists. And you're still here, Jim, by the way.
I'm still here.
Answering innumerable questions about Medicare, long-term care insurance, and estate planning. Katie Burris is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie's a partner at McGrew and Maher Insurance Services and has been in the business for nearly 20 years. She's licensed for life insurance, long-term care insurance, and Medicare in several states. More than several, Katie, right?
Yeah.
Katie has talked to almost as many of you as Jim has, and you're still here too, that's just such good news. From what both Jim and Katie have said, they love meeting and working with all of you, and I can attest to that personally. They are a tremendous resource and blessing to our field. Nancy Sedan is Ardenwood's Director of Finance, and over the course of many years, she's helped many of our patients work with Medicare and other health insurance policies. She too is happy to answer questions. Hey, Nancy. Today, Jim, Katie, and Nancy will provide an update on Medicare plans that best serve Christian scientists, and then we'll answer your questions. Now, as a reminder, you can ask questions using the Q&A button at the bottom of your screen. So let's get started. Jim, Katie, and Nancy, it's all yours.
Hey, good afternoon, everybody. Nice to be back again and talk about our favorite subject, Medicare, right, Katie? This open enrollment period has been pretty crazy already. It really started October 1. That's when insurance companies started disseminating information, but the open enrollment actually starts October 15th. So it's been busy, lots of big changes coming next year, and today we're going to just go through some of them.
So that's the information about us. John did a great job of introducing us. As always, we're broker consultants who specialize in Medicare and long-term care. What that means is we can help you find insurance plans. We have to tell you that we're not affiliated with Medicare, Social Security, CMS, or any other government agency. We have to tell you that ahead of time. So Jim's right. Today, we're going to talk about what's going on now. We're going to talk about the Medicare basics, what Medicare covers, and supplemental coverage as well. So like he mentioned, we're in Medicare's annual enrollment or open enrollment period. That runs from October 15th through December 7th. But Jim, what does that really mean?
Right. So that allows people that have certain types of Medicare plans, like a Medicare Advantage, anything with an initial HMO or PPO out there, if you have one of those, that's the time you can change to another plan in this time frame from October 15th through December 7th. You can also cancel if you have an HMO type plan and go back to original Medicare, which is what we recommend for a lot of Christian scientists. If your goal is to receive spiritual healing, for example, at Arden would, you're much rather be on original Medicare with a supplement than you would be an Advantage plan. But this is a time, not some Christian Science have prescription drug plans, and this is a time that you can either add or drop a plan also.
So one of the questions we get asked most frequently is this time of year does not apply to supplement plans.
Right.
So if you're on a Medicare supplement plan, that just continues to roll over for 2026. That's just going to continue. And if you want to add a supplement plan, that can be done now or at any point of the year.
But that's a good point, because so many people have asked us, what about Plan G? Do I have to do anything? If you have a supplemental Plan G, Katie's right, those are guaranteed renewable. They automatically continue on in 2026. There's nothing you need to do.
So the 2026 premiums for Medicare are going to be released shortly. We have the estimated numbers we're going to go over today. Those should be pretty close, if not exactly what they're going to be, but they're going to be officially released in a few weeks.
Are they going down?
No.
So nothing's going down with the government next year, just so you know that. But like Katie said, we've got a pretty good picture of what they're going to be. The problem right now is with the government shutdown, Normally they would come out and release the rates in sometimes mid to late October. Now they're saying early November, and now they're saying mid-November. But you'll have a pretty good idea of what they're going to be, including all the deductibles in 2026.
The other thing we're seeing a lot of for 2026 clients that we're talking to is a lot of Medicare Advantage plans are going away. So a lot of insurance companies are leaving the markets in certain states. So you may be in a state where you're seeing more options, but we're in an area we're seeing a lot less options.
A lot less, right? And that's a big deal. So people that have had Medicare Advantage plans, if you have an HMO type plan and you're no longer going to be, that plan is going to be available in your service area, that opens up all kinds of opportunities for you, especially if your goal is to get out of those plans. They give you a guaranteed acceptance, meaning if you want to go to a supplemental plan, which we encourage, then that would be the time to do so, right?
Mhm. So the basics of Medicare. So Medicare, original Medicare, is made up of two parts. These you get from Social Security from the federal government. So Part A is the hospital side. That is the part of Medicare that you could use at a religious non-medical healthcare institution like Arden would. For short, I'm going to call them Rinkies because religious non-medical healthcare institution is a mouthful. Part B is the medical insurance side. And if you look on that right-hand side, that shows you what a typical Medicare card looks like.
Right. And the Part B side is important because if you have an emergency, right? That's people go, I don't think I don't need to see a physician or a doctor on a regular basis. But what if something happens to me? Part B is about what if something happens to me scenario, having an accident, a trip, a fall, something like that. That's when Part B comes into play.
And I know, Nancy, one of the questions we get asked most frequently, and I know we kind of talked over it, but if there's anything to add that to be seen at Ardenwood, if Medicare is appropriate, it's Part A that it falls under.
That's correct. That's the only part that is needed to be admitted here at Ardenwood if the care need qualifies.
Perfect. Thank you. Just want to make sure I'm not missing anything. There are 3 times that you can get Medicare A and B, original Medicare. The first time is your initial enrollment period, and this is specific to every single person. So it is based on your birthday when you turn 65. So the month you turn 65, you actually have 3 full months before that, the month you turn 65, and 3 months after. So 7 full months.
So if your birthday is April 16th next year of 1961, you know what that means? You're turning 65. So it's kind of interesting because people think, well, if I'm turning my birthday is April 16th, then I'll start in May. And it's the opposite. They push you forward. So in that scenario, I will turn 65 for all intents and purposes April 1. So you can apply, right, as early as January, and it'll be effective April 1.
I'm going to make one note. If your birthday is the first of the month, it's slightly different.
Right.
We don't bring that up because that's not as common.
So they're really giving you the 7-month window,
Yeah.
say, don't mess it up, okay? Or we can fine you.
So the rules for someone working past 65. So in this case, when your group coverage ends, you do have 8 months to enroll in Medicare Part A and Part B. The problem is some insurance options only give you 2 months to enroll. So you really want to make sure when your group health coverage ends that you're set for Medicare to start at the same time.
Yeah, a good rule to follow is 90 days before you're going to retire. So if I'm 67 or 69, I'm thinking of retiring next year, you want to give yourself especially now, maybe a 4-month window for a smooth transition. So then I can start Part A and B, and there's no penalty because I've been covered by the group health plan. And really, it's not that hard of a process. We can walk you through it and a couple forms you need, but you really want to give yourself enough time. Don't call us like in October 23rd and say I'm retiring November 1st, which we have happened, because the government doesn't act that quickly, and you're dealing with Social Security right now and the government shutdown. So you really want to give yourself plenty of time.
So if I'm retiring at the end of December, what do I need to do?
Yeah, you need to call us and you need to start taking action real soon. And it's not that hard. We can walk you through a scenario on how to do it online. It's not very difficult.
So the third final time that you can enroll in Medicare is it's referred to as the general enrollment period. So the general enrollment period applies if you didn't enroll during your initial enrollment period or your special enrollment period if you worked past 65. The general enrollment period happens every January 1st through March 31st. And during this time, you can apply for Medicare Part A and or B if you need them.
So we should talk about this for a minute because dealing with lots of Christian Scientists, most all of you have Part A. So if you're over 65 and you're receiving Social Security retirement benefits, you're required to have Part A of Medicare. So most of you have Part A, but you don't have Part B. So you can't just randomly during the year say, I think I'm going to add Part B. The government doesn't work like that. You have this 3-month window to add it on. So if you don't have Part B, you can add it on starting January 1 of 2026. If you do it in January, it will be effective in February. If you do it in February, or effective in March, etc. But that's the time you want to add Part B on because we get hundreds of calls talking about that. Should I add Part B? What if I want to get supplemental coverage and I only have Part A? You need both parts A and B if you want to purchase any type of insurance, supplemental or advantage plan.
So if you're enrolling for Part B during this general enrollment period, you could be subject to the penalty. So the penalty says it's a 10% penalty for every 12-month period you should have signed up and didn't. So if it's been less than 12 months that you should have signed up for Medicare and you didn't, the penalty wouldn't apply. But for every 12 months that have passed, it's another 10% penalty.
Exactly. So it's really important for you to consider that and adding it on for protection if you do have an accident and end up in the emergency room, for example, you want to have Part B because that's going to buffer that huge payment that they're going to send you a massive bill. And if you have Part B, at least we know Medicare is going to pay 80% of that. So that's super important to consider.
It also gives you the option to, when picking up Medicare Part B during this time, that you can add supplemental coverage as well. And if you apply during this time, Part A, Part B are going to be effective first of the following month. So applying in January gives you a February 1st effective date, etc. So what does Medicare cover? Why would I have Medicare? So Part A is the hospital insurance side, or would also cover you at a Rinky as long as it is a Medicare approved stay. Nancy, can you talk to us about what that means?
Sure, sure. Um, the uh, the rules for whether a patient qualifies for Medicare involve several different criteria. But basically, if the care need would be best cared for in a hospital, if we weren't a Christian Scientist, then that would qualify. If it's something that can't be taken care of at home by family members, um, it needs the skilled nursing, the Christian Science nursing, that would be one of the criteria as well. And it's important that a skilled Christian Science nurse uh, who's journal listed would be able to designate the need as one that Medicare would cover.
Perfect. Thank you. So Part A is referred to as premium free. It's premium free as long as you or your spouse worked and paid into Medicare taxes for 10 years or longer.
And that's important too, because we do get questions on that. So for a non-working spouse, as long as the other spouse has worked at least 10 years, you can be covered also under his or her Medicare. right? So when Medicare was designed, like Social Security, they said we're not going to punish if some spouse, stay-at-home spouse is taking care of children, things like that, not working outside the household. We're not going to punish them for that. So that's the reason why.
And with Part A, coverage is nationwide, including any hospital or rinky in the US. It does include Hawaii and Alaska and territories. I just couldn't find a map that showed those, but those are included too. So Part A, if you need to go into a hospital or if you need to go into a rinky for a Medicare stay, Medicare Part A works, they call it a benefit period. So the benefit period begins the day you're admitted to either the hospital or the rinky, and it ends after you've left the facility and haven't needed care for at least 60 days. So if you go into a hospital or a rinky and you just have Part A of Medicare for the first 60 days, this is the estimated deductible for 2026. So keep in mind that may change a little bit, but this is the estimate is 1716 for the first 60 days.
Which is affordable,
Mhm.
right? So we see people go, well, that's not horrible. I can afford that. But what if you're day 61 on? That's when it really starts to add up.
Day 61, that per day cost jumps up. And it now becomes, instead of a deductible covering the 60 days, it's a per day cost. And then on day 91, if you're still in the facility, the rinky, the hospital, and it's still a Medicare approved stay, it then also jumps up again to that 858. Days 91 through 150 are referred to as lifetime reserve days. So anytime the stay is more than 90 days, day 91, 92, 93 takes from those 60 lifetime days. So if you used up all the way to 150, you have to go into a hospital or a rinky again for a Medicare stay, and it's over 90 days. Medicare Part A doesn't pay over the 90 days.
Right. And the reason we're showing you this is because we actually have had calls. We've had a couple last year who hit this and they weren't sure. So we want to let everyone know up front, this is going to be your cost if you don't prepare, right? And we're going to talk about how to prepare and protect your assets and your family.
This just kind of gives a breakdown if we look at all of those stays total, what a stay could potentially be.
And that's a big number.
Yeah.
I mean, Nancy, I know last year I talked to at least two that happened to. And, you look at that number, 66,000, and you go, well, okay, that's a big number. When you have to write a check for that,
That hurts.
that really does hurt, right?
Mhm.
We,
So
of course, at the facilities do expect that you're going to go home sooner than that. But
true.
this is good
Yes.
good to
Absolutely.
understand
That's
that
the case, yes.
this could be the maximum.
Absolutely.
Yeah.
We just want to let everyone know that we do get those calls, right? And we're saying
They're
absolutely.
yeah, they don't happen all the time, but we
Right.
have
Yeah.
had some here and there, yeah.
And it's an excellent lead in for this next step. So I'm with you.
Part B is the medical side. Again, you will see that is the estimate. So in 2025, the base premium for Part B is 185. The estimate for next year is that the base premium will go up from 185 to 206.50, all the way up to $702. Anything above the 206 is if you are subject to an IRMA, an income related monthly adjustment amount. That has to do with income. So if you have higher income, you pay higher for your Part B premium. That will, continue for 26 if your income was also high in 24. Same thing with Part A, coverage is nationwide. It includes any doctor or provider that accepts Medicare, bills under Part B. And this is where that late enrollment penalty applies.
Right, and that's pretty steep. So again, I don't think this year we're going to talk during the general enrollment period, but you have to remember if you don't have Part B, you really want to reach out to us in January or even late December, January, February, the worst case, and look at adding Part B. It's only going to protect you, especially if you have an accident or you're taken by ambulance somewhere. Those bills are astronomical right now that we're seeing in ER rooms. And it's a simple fix, right? If you add Part B, and like Katie said, the 10% penalty, well, even if it's 2 years, it's 20%, but at least Medicare is going to come in and be an 80% payer on an emergency room bill, which is going to give you some comfort, not when you're in a state of shock and they show you how much the 6 hour stay in an emergency room cost,
Yeah,
right?
it's a lot. So Part B, the medical side, we highlighted in purple the issues or the usages that we see for Christian Scientists most frequently is like an X-ray or an ambulance emergency room visit kind
And
of
that's
stay.
when we get the big calls on, right? The ambulance and the emergency room. And ambulances are expensive too. Without Medicare, they're buffering it. Yeah, it can be pretty expensive. And we've seen fire departments now starting to charge when they come out too to help people. So that's changing.
That might
So
be a California thing, but
that may
we've
be
seen
kind of what
in
we're saying.
So Part B, the cost for Part B on the coverage with Medicare is a 288 deductible next year. That's the estimate. Currently in 2025, that deductible is 255. After the deductible, you are responsible for 20% of the cost, and there's not a cap. So if you have like an emergency room visit that's $20,000, you'd be responsible for 20% after the deductible.
And there's no cap.
No,
That's why we're
there
telling
should
you
be.
these
Yeah.
emergency room bills that we see are astronomical. They
Yeah.
go in there, and sometimes even as a Christian Scientist, they're going to bring you in there, and if they do any type of X-rays or an MRI or anything like that, it's crazy expensive. I've seen them billed at $10,000 or $20,000.
Yeah.
So if you're going to pay 20% of that, it's better than paying 100%, right? At least if you have Part B in place, and the deductible is nothing, and then you're going to pay 20% of the Medicare approved rate, which really helps. They actually give you a little bit of a discount and you're going to pay on that.
Yep. So Medicare, original Medicare doesn't cover everything. So dental vision is not covered. You still have those out-of-pocket costs. We kind of talked about the deductibles and the copay that you would pay. Prescription drugs are not covered. Hearing is not covered as well. So if you needed eyeglasses, contacts, hearing aids, those type of things are not covered. Long-term care, I know we mention this every time, so long-term care is not covered by Medicare. And also, if you're traveling outside the US, Medicare does not cover you outside the US.
Right. And one thing that they're promoting right now are you're going to see these HMO type plans that they're promoting. They're on every station, every commercial during the open enrollment period. And they're talking about insurance options. And one of them are the Medicare Advantage plans. And the Medicare Advantage plans actually offer that as an enticement, right? So if you're looking beyond healthcare, you go, well, gee, I'm pretty healthy, but they're offering me free vision, dental, hearing. How can I pass that up? Right? It's an enticement, but Christian Scientists beware because those plans are probably not in your best interest.
So once you have Medicare A and B, then it's really up to you to decide, is insurance appropriate? And if so, which one do you prefer? So the first option is to do a Medicare supplement. Most Christian Scientists don't do prescription drug plans, but that's an optional thing to look at. With Medicare supplement, you may have also heard the term Medigap. So Medigap or Medicare supplement mean the exact same thing. So you have to be enrolled in Part A and Part B in order to get the supplement plan. And it may help pay some of the costs that Medicare doesn't cover. So we're going to talk about what it would cover. Plans are offered by private insurance companies in every state. And they could help limit your costs if you end up in a rinky for that Medicare approved stay.
That's a big time. They really do help limit your costs because a lot of times on a Medicare approved stay with the right plan, you're covered in full.
And then nationwide they work and there's not a provider network. So if the Christian Science facility that Rinky takes Medicare and it's a Medicare stay, you can go there, hospitals, doctors, any of the providers that take Medicare.
And if I could just jump in there, Katie,
go
that's
ahead.
a really good slide back there. I just want to reiterate what you just said is that all those numbers that were a little scary there, that $66,000, if you have a Medicare supplemental policy, that's what's going to cover the deductible, the coinsurance amounts. And I'm sure that's about what you're going to show them, but I just want to reiterate that.
Right.
But in order to have that, you do have to sign up for Part B, which you
Hey,
don't need in a Rinky. But in order to get that supplemental, you need to have both A and B. So that's the choice they're talking about.
right.
You are totally correct, Nancy.
That is a big deal. You know, the trade-off is you're going to pay an insurance company a monthly premium, but you're going to have peace of mind knowing that if I do have a stay at Ardenwood, for example, and I have my favorite supplemental plan G like George they're showing, but it's going to be covered in full on a Medicare approved stay. I'm not going to have to worry about writing a large check. Instead, I decide, well, I'm going to pay a smaller premium every month to an insurance company, and I'm not going to worry about that. My adult children don't have to worry about that. And it's total peace of mind for you and them.
So here's the example we used of the costs. But if you have supplement plan G, it would be 0 for that Medicare approved stay. Also on the medical side, we talked about that deductible, estimated deductible for next year of the 288 and then 20% after. With plan G covers that 20%, so you're looking at 288 out of pocket.
And that's a big deal, right? If you have an emergency room visit, I'm telling you, I've seen $8,000, $10,000, $12,000 bills, and they're like, this can't possibly be correct. And I go, it is. So with that plan G, right, you're responsible for that deductible of 288. After that, it's covered in full. So you don't have to worry about it.
Part D is the prescription drug coverage. So if you need prescription drugs, coverage is totally optional. So if you decide not to purchase it originally and you purchase it later, there is a penalty that applies. They're offered by private insurance companies, and you can get coverage in one of two ways. So Advantage plans include them, or you can add it as a standalone plan if you have Medicare and a supplement.
So you know it's kind of tricky. Okay, so let's say I've got A and B and I haven't added insurance. And 3 years later, they decide, hey, you know that commercial on TV? That HMO that says I get all these 27 additional benefits, vision, hearing, dental, rise of the office, paying my PG&E bill, whatever it is. It's amazing what they're offering. But you know, if I did not have a Part D in place when I first turned 65, I'm going to be penalized. And some of those plans have zero premium. So we get calls saying, well, how come I'm paying this extra money every month, right? Because it's supposed to be zero. And the reason is because those Medicare Advantage plans have Part D built in or baked into it. And the government's saying, oh, guess what? Now that you're signing up, now you're subject to penalty.
So this kind of goes over, Jim kind of alluded to, was talking about the penalties. So late enrollment penalties, Part A does not have a penalty as long as you qualify for the premium free. Part B, I know we've mentioned, does for 10 months for every 10% for every 12 months you should have signed up and didn't. And then the Part D, if you go more than 63 days, basically 2 months, you would pay an additional penalty if you pick up a plan. If you never pick up a prescription drug plan, then no
That's
penalty
okay.
applies.
That's exactly right. Or if you drop that Medicare Advantage plan and you go back to original Medicare, you're getting rid of the Part D component that's built into it. And guess what? That penalty goes away. Because a lot of you don't need prescription drug coverage, but they don't tell you that when they enroll you onto one of these plans.
So the second
Could I just
option-
say one thing?
Go ahead.
Just
Yeah.
one quick thing. Sometimes that word penalty is just a big, scary thing. But
Yeah.
if we quantify it, let's just say that the premium per month is $150. 10% is $15 more. So we're only talking about $165.
Correct.
Or if it's 2 years, it's $30 more. So
Yes.
that 10%, 20% sounds really scary, but
Right.
that's all
Yeah.
that means.
That's how Medicare puts it out, and so that's how we're supposed to say. But you are correct. Yes, absolutely.
but it's every month for the rest of your
Yeah.
life.
Yeah.
So it is. That's why we want to just make sure people, if you're going to sign up for it, it's better to sign up for it earlier rather than wait a year or two, so you don't incur another 10 or 20% on top of that penalty.
Yep. Medicare Advantage plan, it would be the other option for insurance. So Medicare Advantage plans are HMO, PPO type plans. You can tell that it's a Medicare Advantage plan on your card. It's gonna have the initials, so it's gonna say HMO or it's gonna say PPO on it. Um, they're not Rinky friendly. So I know we've heard from, Arden Wood that they don't necessarily always work very well with Arden Wood. Can you speak to that, Nancy?
Yeah, sure. Um, the couple of problems that we've seen with patients that have this have to do with first, at admission time, you need to get approval from your plan in order to be admitted and for them to pay. And so that means that there has to be a lot of phone calls between the Ardenwood and your plan to help them understand where you are and why your plan has to cover you here, which legally in the Medicare law, if you have a Medicare Advantage plan, you should be able to use your benefit at a Rinky. But a lot of these Advantage plans haven't ever heard of a Rinky and they don't understand that part of the law. And so there's quite a tussle. Our nursing staff has actually spent hours, days, trying to get through and get the right paperwork so that your plan will actually pay. And then once we're at the billing stage and we're trying to get paid for the care we've provided, we've run into the same problem again. In fact, we had a patient here in January and we still haven't been paid for them.
Right.
So
Yeah.
there are these issues, but basically it's having to get that authorization is one of the key issues that our patients have
Right.
experienced.
It's one of those things where I talk about a lot with, any sort of insurance. There's the way things should work, and there's the way things work with insurance. And it's supposed to work where people can see or can be seen in a rinky. And a lot of times we're just seeing that that's not the case.
Right.
And that I know Arden would, you guys need to be paid for what you do. And so the Medicare Advantage plans just make that more difficult, if not don't pay at all.
And there's so many Christian Scientists out there that think, well, something's better than nothing, right? I mean, we get that a lot. And it's like, well, this plan was really zero premium, and my daughter and my son thought I should get it, and I did. But if your goal is to have spiritual healing, like at Arden Wood, you do not want to have this type plan. This is not going to help you. You want to be on original Medicare and be covered under Part A. And if you have Part B and a supplement, that's what's really going to help you. Really is.
And I know Jim had mentioned, the Medicare Advantage plans, most of them include prescription drug coverage. So if you have a penalty, the penalty applies for having the plan. And now is that time of year where you can look at dropping the Advantage plan, because that can be done between October 15th and December 7th each year.
Right. And people, I mean, I'm just telling you the calls we get. So a lot of times they go, I'm not sure. I think I have that plan you were talking about that. And it's like, well, you look in your wallet and you pull out that card. And if it has any kind of initial HMO or PPO, that's the Advantage plan. And like Katie said, you need to think about it and pray about it and decide if now's the time to make a move and either just totally get rid of that plan and have just parts A and B of Medicare, or add supplemental coverage. But now is that time, right? And we get a lot of calls December 6th or December 7th saying, what should we do? You want to consider it now, and you're happy, we'll have our contact information at the end, or even email us and say, what should I do? You can scan us a copy of your card and we can tell you what you have.
And can I just say that contrary to that, if you had original Part A in your wallet and came to Ardenwood, the only thing you have to do is sign one document that you're saying you want your Medicare benefits to pay here. That's it.
Perfect.
You are in. if you have a Medicare supplemental plan, it'll automatically pay. Medicare will automatically pay. So it's a much smoother, simpler, and it allows you to go anywhere in the country if you're in Part A, as they've said. There are other rinkies if you're in a different part of the country that you could go to. Whereas the Advantage plans are all local for the most part.
That's right. And we get that question a lot, depending on especially in the East Coast, can we go to the mother church right back there? And um, you've just got to prepare for it. A lot of Christian Scientists, you're incredible. God's blessed you with incredible health. You're savers, you're not spenders, but you save all this money and you want to take that next step and mitigate all those healthcare costs and retirement so you don't worry about it. That would be the next step. Like Nancy says, make sure you have the right plan, part A and B, and then decide whether you want to do the supplemental coverage. That's up to you. But I highly encourage you to even add part B. So that way in an emergency, right? We've already talked about that. But if I go into an emergency room with part B, it's going to be my buffer. Medicare is going to pay 80% of that claim. I'm only going to be on the hook for 20% of the Medicare approved rate.
Most important thing you need to know, I know there was a lot of information. Sometimes
Right.
we talk fast, that you can either call or email Jim or myself. Either one of us can help you. So there's never a charge to work with you. The insurance companies pay us if you do your applications through us. And then the good news is you call us and we can assist you with your plan. And then we help you maintain your plan over time. So I got a question the other day. What does that mean? And I said, an insurance company is never going to send you a notice saying, you should check out our competitors. They're better priced, it's better coverage. That's what we're here to help with, is to help you shop as your needs change over time.
Exactly. One last point again. So if you do have a supplemental plan like G, or some of you may have plan F like Frank, the open enrollment period does not pertain to changing those policies, because we've already had several calls on that and it's super confusing. It's like, well, this is the time to change my supplemental plan, and it's not. So again, if you have a supplemental plan, it's guaranteed renewable and you're set, right? It's going to roll right into 2026. You don't need to do anything at all. So rest assured you're okay. What else? Do we have any questions, John, by any chance?
We do. This is a great presentation. Thank you, guys. First up, Medicare question. I've been in the hospital with a broken leg for a week. I know I have basic Medicare coverage given my age. What I don't know, and they won't ever tell you, is how much cost is being run up every day. It doesn't look like I'm going to get out of here right away. My preference, of course, is to be at Sunrise Haven, which is in the Seattle area. But I am not movable enough at this point to be able to do that. How can I know how much Medicare will cover?
Well, we know up to 60 days, right? It's going to be your Part A deductible. So you don't have to worry about, because that bill will be, it's going to be a lot, but you're responsible for the Part A deductible. And we know next year it's going to be, what did we say,
1716.
1716. So
this year it's a little under 1700.
It's a little under 1700.
For that, the first 60 days in the hospital.
Right. So you just want to make sure you're out of there in 60 days, but you should be, right? You should be healed and good to go and coverage under Part A. Did that
Great.
make sense? Anything you want to add, Nancy, or?
Sure.
Not
I
to
mean,
put you on the
that's,
spot.
No, I was just,
we're not an expert about that side, the hospital side of things, but there probably will be some Part B costs as well, right? Having to do with physicians that are taking care
it
of.
could be.
care of
Yeah, right now, what we're seeing is everything's going to be billed under A, so they should be
hospital.
okay, right?
Mhm.
Hopefully, but if they were, if they were taken over by ambulance, right? That's going to be under Part B, and that's going to be expensive. So that's why at least having Part B as a buffer, where you're only going to pay 20%, not the whole entire bill.
I think this ties in, but the Advanced Healthcare Directive, or AHCD, is helpful in a case like this. If the person weren't able to be completely clear when they were admitted, and sounds like just with a claim of broken leg is not that serious, but or relatively speaking. And so, but that's where you have your plans set up ahead of time. So you could be able to leave the hospital if you wanted to go to Sunrise Haven or Ardenwood or whatever. So it's just good to have all those things spelled out.
So John, let me ask a question. So if I'm a Christian Scientist, how do they know? So if I break a leg or if I'm unconscious, they're going to take me to the nearest hospital anyways, right? By
Typically,
ambulance.
that's right.
So
Right.
I know
Even if sometimes if you show, I've been told that sometimes even if you show the AHCD, the ambulance company is told you're going X, you're going
to the
Y.
nearest hospital, right?
Right.
So what happens? I get into the emergency room. I know you've spoken about this in the past. So how do you tell? Will they release you? All right. If you say I don't want any, I want spiritual healing and I don't want to be here, will they automatically release you at that point?
If you produce the document.
But you
Yes.
have to have the document. Okay. All right.
Right. You have to have some sort of documentation, because I remember in my case, just by asking, this was pre-Medicare time, but they said he's not going anywhere. And it was really by contacting our director of Christian Science nursing, having a conversation with the director of the ER unit at the hospital that said, oh, then that sounds good. That's something that she understood. When we first said Ardenwood, it meant nothing, but we said that Ardenwood is a Medicare Part A facility. Okay, he can leave. So
they would release you, assuming that you're going to go into a Part A, another hospital.
Right, to receive care.
Right.
Exactly.
Right. So
yeah. It's interesting.
It's crucial. You have to have that document then, right, somewhere.
You really do.
Yeah.
Yeah. It was with a loved one and being able to access it easily. And that's where we've talked about, putting it on your refrigerator or a place that your family and or those that love you and care for you,
you put on your
know where to find it.
iPhone, right? I mean,
some people have it on their iPhone or their smartphone.
No, well, I'll hold it up the back, but right, you want to have it. It really hit me just when you're saying that, because I kept thinking, well, they're going to listen to me, but you have to produce that document.
You do, and you can email it to them or whatever. So.
Okay.
And I know you guys have it on your website if you want to talk about that, because
right.
we get calls all the time on that.
Right.
Sure. Thank you for that. So our website is ardenwood.org. And if you go to the that website and on our homepage, you just scroll down to the middle, and there's a section there that says general information. It's divided into 3 sections, and under general information is right where you can click on the link to that document, a form that you can customize to your own wishes, and it enables you to appoint someone that can speak on your behalf. It enables you to establish what your wishes are if you were in emergency and you couldn't specify it yourself. And so it's a legal document that allows you the protection of having the care that you need, that you've prepared for ahead of time. So on our website in the middle, general information. Also, if you scroll all the way down on the left-hand side, there is a section that says healthcare documents, and you can click on that as well. And it takes you to a page that has the healthcare, advanced healthcare, but also a nice summary of Medicare benefits for Christian Scientists, sort of a review of what Jim and Katie have talked about, but with the specific slant of Christian Science. So it's a wonderful document to also look at and be able to read over and sort of digest some of the things they've said as it relates to Christian Scientists.
And you provide that at no cost to
of
any
course.
Christian Scientist. Wow.
Yes.
Okay.
I've actually referenced
that's a big deal.
I've told people go to their website. That's a great document.
It is.
I love that document.
And at the end of it, it also has metaphysical articles that help us think about the spiritual side of care. So there's a lot of good references there, as well as just reiterating all the good information that Katie and Jim have shared.
We strive to be a good resource. So great. Next up, can you live at Ardenwood under Medicare Part A? Are there certain physical conditions that you are subject to be admitted, or is a certain age required? Is Ardenwood a non-medical senior living place? Well,
Okay, there's several different questions
so
in there,
a
I
lot of
think.
strange there.
You're on, Nancy.
Um,
So our independent living residential program is for individuals that want to come here and make it their home. And it's beautiful living here. That, of course, would not be covered by Medicare. Medicare is an
Right.
insurance policy for those that have physical needs. So the independent living is not covered by Medicare. We also have sheltered care, which is sort of a equivalent to assisted living in other situations. That is not covered by Medicare either. But in our skilled Christian Science nursing, like the example we were just given, if someone had broken their leg and needed to recover and have assistance in learning how to walk again and through that healing process, that would be covered by Medicare. And I should mention, I don't think we mentioned this before, that uh, the care needs that are covered under Medicare at Orinki include hospital level as well as skilled nursing facility, otherwise known as a SNF, recovery kind of entities. So the care need could be if one went to a hospital or if one went to a skilled nursing facility. Those are the care needs that Medicare will pay for here at Ardenwood when you get Christian Science nursing, skilled nursing care.
Great. Thank you, Nancy. Next up, I'm totally ignorant as to the terms they're using. What is a deductible? Does that mean how much is paid before the patient starts paying?
Yes.
No,
The
so the
deductible?
deductible is what the
Okay.
patient would
Oh,
pay.
I'm so sorry.
Right.
I'm sorry. Yeah,
Right.
no, understood. Yeah, that's my, I apologize for that. Right. Yeah. Um, well, that's you're talking about the Part A deductible
Yeah.
in that scenario, right? That's what you'd be responsible for, which is you'd much rather have that than a per day cost, right? For 60 days. That's kind of a deal, actually, when you look if I'm limited to that plus or minus $1,700.
Mhm.
Right. So as you just said, for the first 60 days of care at Ardenwood or any other Rinky, and your condition is covered by Medicare, all you're paying is the deductible, the 1,676 right now in 2025. And Medicare pays the rest. So that's the deductible term. The premium is the other term they were using, and that's if you had Part B or if you had the Medicare supplemental policy, you would be paying something every month, regardless of the fact that you're not needing to go to a Rinky. So that's the difference between a deductible or
Very good.
/ coinsurance
Thank
and
you, Nancy.
the premiums. Yeah.
Exactly right. Great. Thank you. Why are dental and vision insurance not the best in the best interests to Christian Scientists?
Oh, wait, I don't
Okay,
think that.
so
Sorry, go
I
ahead.
think there was confusion maybe with the way that I said that. So original Medicare doesn't cover dental and vision, but
Mhm.
dental and vision can still be purchased as a Christian Scientist. I and Jim always say with dental or vision insurance, you want to make sure that your provider is in network because the plan works a lot better. Um, Dental and vision is included with some of the Medicare Advantage plans, and Medicare Advantage plans usually are not recommended for Christian Scientists. That's not saying that dental and vision overall is not recommended for Christian Scientists. So I'm sorry about the confusion on that.
But that's an enticement. When they're calling you and telling you as a Christian Scientist, look, you don't have a plan now. Why don't you get this, right? It includes dental and vision and hearing and prescription drug coverage. And in case you ever need it, it's zero premium. Why don't you want to get that plan? And most people think, well, it's better than nothing. And I think that's really going to help me. So they enroll for it because of the dental, vision, and hearing enticement.
The other thing too is on Medicare Advantage plans, That dental that's included, what we find is a lot of times, because we have non-Christian Science clients that have Medicare Advantage plans, that dental a lot of times isn't used by the member when they sign up for the plan because a lot of dentists are not in network on those HMO plans. So if you have a dentist that's more established, they're normally not in network for like the free dental plan you get with an Advantage plan.
Guarantee you they're not going to be in
Yeah,
network. If they're an established dentist, they're not going to be an HMO dental plan.
Next up, I had emergency surgery for a broken leg on October 10th. I was in the hospital for a week, then released last Saturday to a rehab center. I have Part A with no Part B now. What do I do?
Well, there's a lot of depends there. So if they were admitted in the hospital, right, it would be covered under Part A.
As long as it was 3 days.
As long as it's 3 days discharge on the fourth day into a skilled nursing facility, you'd still be covered under Part A. And then Medicare would pick up the first 20 days for skilled care. I think you should email us or call us on that.
Let's not get too far down there.
We're going to confuse people if we go into that.
Yeah.
But you should have coverage for that, right? After 20 days, if it's no longer, well, if it's not skilled, you're going to pay out of pocket. But after that, it gets expensive.
Send an email to either Jim or myself or both of us, and our contact information's at the end. But you're right, I don't want to confuse too much.
People.
Yeah.
Here's one. Is Plan G considered a supplemental plan?
Yes.
Yes.
I like the easy ones. Can I drop Plan B? If so, when?
You can drop Part B. Yeah.
You can drop Part B.
She said Plan B, or he.
Part B. Normally we see, hey, I've been retired, I'm going back to work now, I'm 68 or 69, and guess what? The company is offering me health. They have a health plan, a group health plan. So if I'm going to go back on the health plan, I don't need Part B as in boy. I want to drop that. There's forms you can get from Social Security. They handle the disenrollment. And so you can disenroll. I go back on the company's plan. And if I'm there for a year or two, for example, and then I'm going to retire finally again, then you can re-add Part B and there's no penalty. So you absolutely can disenroll from Part B. And that's the scenario we see quite often, actually.
As far as having Part A and Part B and not, going back onto a group plan, just be careful if you drop that Part B, because I know we've mentioned if something were to happen, you don't have any medical coverage. So you'd be on the hook for whatever the bill is if it's an emergency room visit or anything like that.
And we just had 2 questions about that, right? What if I go by ambulance and I'm in an emergency room? That's all under Part B.
Yeah.
So at least Part B, even though you're paying that monthly premium, it gives you that buffer. Remember, with Part B, Medicare is going to pay 80% and you're only going to pay 20%. And you'd rather pay 20% of a $10,000 or $15,000 bill than you would 100%.
The costs that we've emphasized earlier is very high.
Okay.
Yes. I guess this goes back to the first question. My desire was to go to Sunrise Haven in Kent, Washington, but the hospital insisted I go to where there was physical therapy offered. Am I going to face a big bill?
Again, it depends. If you're admitted under Part A in the hospital and you spend it gets technical. You have to spend 3 nights, right? At least in an outside hospital, 3 midnights. And then if you're discharged into a skilled nursing facility, you're covered by Medicare under Part A for the first 20 days. Because we start going down the rabbit hole.
Yeah.
I think cases like that, you can email us or call us and we can help you. But that's how it's supposed to work, right? And then after that, then it gets expensive if you're still receiving skilled care. If you have a supplemental plan, for example, after 20 days, I have Plan G. If I'm still on skilled care, my supplemental plan's paying up to the 100th day. So that's another.
Because it's still skilled.
As long as it's still skilled care. Yeah, that's the premise. But so that's a good reason to look at a Plan G, actually.
I encourage the questioner to reach out to Jim and Katie on this. Yeah. Next up, I have a supplemental plan with Blue Shield through my former employer, but I don't understand what the supplement Plan G is that you've been mentioning. Can you explain what the G is?
So supplement plans have different letters. You have A, B, D, F, and we reference Plan G just because it's the most benefit-rich plan that most people can get, unless you were born in 1954 or earlier. So Plan G just happens to be the most benefit-rich plan, so you don't have to worry about
Excuse me.
gotchas or
Right.
certain questions to ask. It just is the easiest to deal with.
It's easy, right? It really is. It makes life easy.
And the costs are substantial, as we've said.
And you know what? She mentioned a Blue Shield. There are group retiree plans out there. I'm not sure if she's talking individual or group.
Group retiree.
Yeah. So and here's what's changing out there. Speaking of group plans, like we've had some people like Hewlett Packard and some of the big companies, they're dropping their plans. They've had their group plans. So if that happens to you, you're automatically eligible to convert that to an individual plan, right? So if the company says we're no longer offering this group retiree plan, that makes you eligible for a special enrollment period to purchase an individual plan, and there's no waiting periods or pre-existing conditions.
That's what we can help with because we do that.
It's important. We were seeing a lot.
All,
Right?
yeah, a lot this year.
John, you see a lot of these big companies that say, hey, you work here 30 years, we're going to take care of you forever. Well, forever has come because now they're calling and saying we can't afford the future funding on these plans. So we're seeing that happen to lots of group retiree plans.
We've sure seen that. Yeah. Next up, if I had an Advantage plan and I want to go to a supplemental insurance like G, and I have Part A and Part B, will I have to have a medical examination or answer lots of medical questions? Do I understand correctly that I would make this change during the October 15th through December 7th timeframe?
Yes, it would be between October 15th and December 7th. No medical exam required health questions would be, and that's where we can help.
Right.
That's what our job is, to help with that. We can ask the health questions ahead of time, so you don't have to waste time like applying for the plan and not know. We would ask the health questions ahead of time.
Because if you answer no to the health questions, you're automatically going to be eligible for the plan. So, and there is no physical. Physicals are more life insurance, right? If you're going to apply for life insurance. For supplemental plans, it's simply answering the health questions. So just so you know, everybody out there, so most all health questions are, have you seen a licensed medical provider in the last 3 years, 5 years, 4? Well, most Christian Scientists have not seen a licensed medical provider, right? So most of the time, Christian Scientists answer those questions no. So that's why it's easier for a lot of Christian Scientists to get a supplemental policy than for someone like myself. Have you seen a doctor or had anything in the last 90 days or a year? Yes. Well, then I would not be eligible for that plan. It's pretty cut and dry.
Mm-hmm.
Thank you. Next up, could you explain again briefly about the penalty if adding Part D after the fact? It seems there is a penalty plus 10 or 20% on something. Sorry, I didn't quite get it.
Yeah, no, I know.
It is so confusing, right?
So Part D is the prescription drug side. The Part D penalty, only if you add a prescription drug plan at a later date. If you don't, it doesn't apply. If you add it, what Medicare does is it's 36 cents per month that you didn't have that prescription drug coverage since you've been on Medicare.
Right.
So if it's a year, it's between $4 and $5. So basically it's between $4 and $5 for every year you didn't have it.
Right.
Yeah.
If you wait 10 years, because we've seen that too, and they go, well, gee, I want to add it or something. You're looking at like $43.
Mm-hmm.
I just did the math here. It wasn't my brain. I used my thumb. I'm not that quick, but yeah, but you really want, and the other option is, listen, if you have an Advantage plan and you're paying a penalty, right? If you drop that Advantage plan and you go back to original Medicare and you don't need a Part D, you're not getting a Part D, that penalty goes away. Mm-hmm. So that's something to consider also.
We've got a lot of questions here, so we're at the top of the hour, but we'll keep going.
All right.
How do you tell if your supplemental policy is a Plan G? I'm looking at my monthly premium invoice, and I do not see anywhere with a reference to Plan G.
I'm trying to get a visual here, John. Let's see. Oh, can you see that? So that's my, it says on there, Plan G, right? I'm showing you my personal stuff, but that's okay. So in your wallet, you're going to have an ID card. That's my first,
That's right there.
says
Plan
Plan
G.
G. So every supplemental card will have the number on there, whether it's Plan F or G. So that's how you tell.
Yep.
Does that visual
Perfect.
help?
It does not, but
I forgot to black out.
What is
my-
that commercial? What's in your wallet? I've had Medicare Part A only for some years. Medicare Part A only for some years. Is it possible to enroll temporarily in Medicare Part B to enable a covered minor surgery procedure and then unenroll soon afterwards? How practical is something like this?
Well, so let's just talk about how easy it is to add Part B. You can add Part B during the general enrollment period starting January 1. So you start there, and if you enroll in January, it's going to be effective February 1. So any services you receive under that, under Part B after February 1, are going to be covered. Medicare is going to pay 80%. You're going to pay 20% deductible, the $288 deductible, and you're going to pay 20%. It's up to you to decide how long you're going to keep that. Because if you're using it now, think about, well, what if something happens 6 months from now? Maybe. So I think you should be prudent, and I would have a tendency to keep Part B as long as that premium's affordable.
The other thing too
Right.
is a lot of times if you do a surgery, they're going to want you to follow up.
Exactly.
And that is legally, they can't just do a surgery and then
Right.
tell you good luck. Don't come back.
So we're not saying sign up and then disenroll. That would not be our recommendation. Mine would be to keep Part B.
Next up, what do supplemental plans cost? That's a question we always get, isn't it?
So I would say, so asking like what a supplemental plan costs is kind of like saying, what does a car cost?
Right.
So supplement plans are based on your home zip code and your age. Most of the time, sometimes it's just based on home zip code, and every state has different rules.
Right.
Sometimes it's
Different
based on male and
costs.
female.
Right.
Reach out to us and we can tell you specifically what it costs for you.
Certain states have guaranteed issue, meaning you can enroll anytime. Well, insurance companies go, well, we have to take everybody anytime. Well, the rates are going to be double what they are, for example, in California, right? Where if it's after your initial guarantee, you have to make sure you're healthy enough. Some states, if they take you and they have to take you, the premiums are double. So it really depends what state. And you'd think some states would be less, and it's really interesting. Like Colorado's not a super expensive state, but I found that like Idaho, right, seems to be expensive. Florida's expensive.
California's not.
Cheap.
The only thing we're not expensive.
Right. Gas, everything else is high, but supplements are pretty reasonable in California.
So that's why we don't talk pricing on it, because it's
just-
so.
We just don't know.
Yeah.
Right. Yeah.
Next up, how do I choose a Medicare supplemental plan? Just look at the cheapest one?
No, don't ever buy cheap, man. My mom told me don't ever buy cheap. Don't buy cheap shoes. Don't buy cheap mattress. But you know how you figure that out, John? So you realize when your mom's right. Okay, I just got to tell us because this is true. I started off in insurance, and back in the day, in the late 80s, you used to do a lot of walking and door knocking. So I go, well, I'm going to buy these cheap shoes. You know, I give them $29 or whatever they were, Payless shoes or whatever, the drugstore. And so after about a week of your feet killing you, and 2 weeks later, you're going, okay, I got to get another pair. So I go to the $39 pair instead of the $29 pair. Okay, I'm going to do that. And man, my feet were still killing me. The third pair, I actually spent like $59, and that was a lot back in the 80s. It's a true story. And I go, okay, and guess what? A month later, my feet were still hurting me. So I talked to my wife. I said, we don't have a lot of money, but listen, I got to do something. I bought I think they were Florsheim or something. They were really an expensive brand. I think I paid $89 or $99. Guess what? Oh man, my feet felt so good. And all I could hear my mom was saying, don't buy cheap shoes, right? But I learned the hard way. The same with the mattress. So true story. It took me a long time, and I spent a lot of more money if I would just bought the expensive shoes first. But nope, I got to buy the cheap ones. So with insurance, you never want to buy cheap. We see companies coming into the market all the time, cheap, right? And then gone. And what they do, just so you know, insurance
Mhm.
lingo wise, so they build up this block of customers and then they close it, right? They go, well, it's not profitable, but they still have them on there. So if you have all these unhealthy people on this block of business, this insurance, guess what? The rates have nowhere to go but up because they have to start charging you more because they have a lot of sicker people. Did I answer that? I know I got kind of carried away, but my
Mm.
mom was always right, right? Don't buy cheap shoes, cheap mattress, and I would never buy cheap
She'd be
insurance,
proud of you for
ever.
saying she's right.
And just
You
consider
want to buy companies that have been around, that are well established in the
well rated.
Medicare supplement field, not the, flavor of the month that's, hey, we're the lowest cost in your state.
And call Jim and Katie because they can tell you what's
Right.
available and what's best for you.
And a
So
good pair
it's
of
just an
shoes.
individual question. Mhm. Also, how do we pay for Part B when we are not collecting Social Security yet?
Yep. Social Security is going to bill you quarterly for those Part B premiums until you start taking Social Security, and then they'll take it out of your Social Security monthly.
Great. It sounds like we have to sign up for Part B with the penalty attached. Is Part B required or is it a choice?
Part B is a choice, but if
Mhm.
you're looking at doing a supplement, supplements do require Part
That's
B. I'm trying to answer fast because you
Right.
said we have questions.
No, but
Yeah, no,
Now
there
I'm
are.
stressed.
I've got
and
a
remember,
lot of questions.
you can
And
do
remember
that
that to be
starting in
admitted at
January.
Rinky and have Medicare pay, all you need is Part A.
Right.
Right.
But they're giving you good reasons why Part B might be a good option as well.
Exactly. Does it make sense to minimize taxable income in the 2 years preceding applying to Medicare in order to minimize the IRMA-related extra premiums?
Yes. That's a really astute question, by the way. That's exactly right.
Yes.
So right now in 2025, they're looking at your 23 tax return, and then starting in January of 2026, they're going to look at your 24 return. They look at your modified adjusted gross income. And we see that all the time. People go, well, I didn't know. I just sold my home. I sold a home 2 years ago, and I've sold in the Bay Area, and we had a $500,000 gain and all this. So absolutely, that's very astute. I would sit down with your financial planner, right, and go over that and say, when is the best time? Or John, the other thing, what if I'm taking a large distribution from my 401k or my IRA? The same thing. We see that all the time. You may not want to take it all in 1 year and spread it over a couple of years so you lessen the impact because people never think of that. That's really a smart question, right? They never think of that. And then when it happens, we're like, well, no one ever told us. And we didn't know. So,
Exactly. Good question, good answer. How much does an ambulance ride cost?
oh, a lot. Wow.
Well,
I can tell you.
I can speak to that. So my daughter, and this was about 10 years ago, she had to go, oh man, it was like a couple miles. The bill at that time was over $1,300 just
Yeah.
for that.
I would say now that we see people at least $2,500 plus, at least for an ambulance ride.
Yeah.
Right. And
Yeah,
people, go ahead, John.
when I hit the deck, this is in 2012. I wasn't feeling well. Some have heard this story. I wasn't feeling well. I was getting my car serviced, and I hit the deck and woke up in San Francisco General, 9 miles distance from the dealership to San Francisco General. 32 minutes. It was like $3,000.
Oh, wow. Yeah. It's really expensive. And now
So when
in
you
some
see an
areas-
ambulance, they're
Yeah.
not free.
And now in some areas up here in Sacramento, they're charging if the fire department comes out. We've had
Right.
clients say, "Hey, I just got billed another $350, right? What's up with that?" So a lot of the fire departments are starting to charge for that also.
Yeah, it's not free.
Uh,
Exactly. Question. Do you have to live in California to use an AHCD? I noticed that the document you provide has a California notary section. Can it be used in other states as well? Nancy?
Oh, great question. It's a template that gives you an idea of the
Precisely.
kinds of things you want to have in your advanced healthcare directive. It is customized to California, yes. And so you should take it to an attorney in your own state and make sure that it qualifies or has all the right specifications for your particular state. But in general, the things that it covers are consistent among states for the most part. Not that I'm an expert in every other state, but
Absolutely.
yeah. But again, you would want to have this as a part of your estate plan to have this document, and it's part of what you would want your attorney to double check for you.
Absolutely. In today's world, an advanced healthcare directive is just essential. It's just the world we're in right now. What are supplement plans part D, E, F, and G? I don't know if we can have time for that, but
Yeah, those are different options. Some of them are
right.
not offered in every state. Some insurance companies don't offer all those different plans. They're just different, have different deductibles and co-insurance, right? Basically.
And I'm not sure if you remember, but they put up a wonderful slide that was sort of a grid, and it had different all the different plans and the benefits on the left-hand side and check marks, so you can see.
Right.
You can also compare it, and that's in your Medicare and You booklet. If you received it, if you're over 65, or it's online also if you wanted to get that, or just go back and look at their slides when we post this on the website.
Right.
Next up, I have Part A only, and I am over 85. Surgery, which required hospitalization, was considered outpatient surgery, even though the type of surgery and doctor required it. So hospital would not accept Part A and said I'd have to pay $19,600 for a 5-hour stay. Found out that the average cost across the country was $6,000 for similar surgery. Was told that I could meet with the hospital to try to get a reduced fee. Apparently, the hospitals may also charge for days required for observation after surgery as charged outside of Medicare.
Right.
Not sure that insurance can be counted on as covering what we are told. Hospitalization does not mean hospitalization.
Well, she means covered under Part A. That's exactly right. So if you're in a hospital for something like that, you can be admitted under Part B as in boy, not A. So therefore, she wouldn't have coverage under Part A and be billed for Part B services. That's where the supplemental plan comes in. You don't have to worry about that, right? If you have G, for example, you'd be paying that Part B deductible of $257, and then you're covered in full. You're not paying a $19,000 bill, right? Did that make sense? Hopefully.
Mm-hmm. But how do we help her in this case?
She's going to have to reach out to us. I mean, she can add Part B, right, going forward, starting in January. But right now, she's gonna have to pay, right? But what I would recommend is talking to their billing department and seeing if they can set up some type of a payment plan and reduced. Talk to them about your Christian Scientist and see if they can help you and set up a payment plan, right?
Yeah, and
you
contact
can
you
always
both.
reach out and we can try to
Right.
assist
Yeah.
in any way we can.
Yeah.
Yeah.
Yeah. Next up, how long do I have to enroll in Part B Medicare when my group healthcare plan expires on November 16th? I was of the understanding that as long as I was employed in a company that had a large group health plan, I was not required to enroll in Part B until the group coverage expired.
That is absolutely correct. So if you're in a group with more than 20 employees, you do not have to enroll in A and B until you come off that group plan. Once you come off that group plan, you technically have 8 months. But once that group plan ends, Medicare is supposed to be your primary. So if you don't sign up for it and something happens while you're waiting to apply for A and B, you would be on the hook for whatever those costs are. But you are correct that you do not have to apply for A and B until you come off that group plan.
Great. Well, here's a wonderful question statement. First, I want to give a shout out to Jim and Katie. Yay! I put in the yay. They helped us with my husband's enrollment and were fabulous. I wanted to share that I recently went with my sister, who's a non-Christian Scientist, to her medical appointment. I'd been in some of these webinars, so I inquired with her doctor about the Medicare system. She said payments to medical doctors has become very complex and costly for patients. She highly recommends to all their patients what Katie and Jim are recommending: Medicare Parts A and B and Supplemental G. So there you go.
Oh, well, thank you. Right.
Thank you, questioner or participant. Thank you for that. This is why we do this in terms of it's complicated, friends, and it's expensive. So this is why we just go through the different options. That's what this is education. Next up, if you have A and B, can you get G during the annual enrollment period?
You can get G any month, right? You can get it now, or you can get it in November, December, January. You just have to be able to answer the health questions no. Again, no physicals. If you can say answer no to all the health questions, you can get that. So you don't have to do that during the open enrollment period. People think that supplemental plans apply, and they don't. Only the HMO type plans and Part D prescription drug plans.
Great. Next up, I think this questioner is returning to F, but anyway, I'll read the question. Is G not available if you were born after 1954? What if you were born before 1950? Is there a better plan than G for those who were born after, is there a better plan than G for those who were born before 1954?
John, you're correct. So Plan F is not available if you were born after 1954. So if your birthday is 1955 or later, Plan F is not available.
Right.
1954 or earlier, including 1950, you would be eligible for Plan F. Yes, you're correct, John.
Great. I think that's all of our questions.
Perfect.
That's all of our questions. Good.
Awesome.
Wait, hold on. We have one more. One more. Two more.
Okay.
Are Jim and Katie licensed in Maryland?
Yes.
Yes.
So I thought. Is there a best time frame to apply for IRMA? IRMA.
So you don't apply for the IRMA. You apply for Part B. If you're subject to an IRMA, don't you worry. Social Security is going to catch that. So when you apply for Part B, Social Security automatically talks to the IRS to pull your tax return. So in 2025, they're pulling your tax return, your numbers for 2023. If you're an individual that had income over 106,000 in 2023 or a couple over 212, then that's when the IRMA would kick in. If you have to pay an IRMA, Social Security sends you a letter. So they'll tell you, hey, we checked with the IRS. You're subject to an IRMA. Here's the income you had in 2023. If you have a life-changing event, you can actually request the reduction of that IRMA before and not have to wait 2 years for that to catch up. So if you have something that's changed, you stopped working part-time, lost a spouse, there's 8 different reasons. You can always reach out. We have the form that we can get you as well.
And you always want to ask, because if you don't ask, you're going to pay. But a lot of times, like Katie said, we've had higher earners come in here that are making a lot of money, and you're following their rules. Hey, I have work stoppage. I don't have my job anymore. I'm on fixed income now, drawing Social Security, right, or drawing from an IRA. I don't have that income. Can you please help? You'd be surprised how often they help you right there. Social Security employees sometimes get a bad rap, but there's some really empathetic employees out there with Social Security that will help you. You just have to be honest with them and tell them the truth. Hey, I don't have that job any longer. I'm working part-time. I don't have that income. And can you please help me? And then stop. Don't tell me your life story on how much you made all these years, and don't wear a Rolex to the meeting, right? But seriously, I've seen them help so many clients like that. But you do have to ask.
I tend to be a talker, so I feel that. But it's like when you're talking with an attorney, answer as asked.
Right.
Don't provide more information.
Yeah.
John, you're muted.
You're muted.
I love this statement. It was in a previous work life, but in these situations, when you're dealing with these types of situations, be a well, not a fountain.
There you go. Okay.
Answer the question,
Right.
but don't like,
Right.
whoa. Okay.
Yes.
Last question. I have Medicare. I have a Medicare Advantage plan HMO. Does that mean I already have Part G? If not, is there a penalty to sign up now after over 2 years late?
No. So if you have a Advantage plan, you have Parts A and B, and you have a Medicare Advantage HMO type plan, you do not have a supplemental plan. Now's the time you can disenroll, right? Get off that HMO plan and go back and get a supplemental plan. Again, as long as you can answer the health questions no, you can get that. And if you're a Christian Scientist, I would recommend that over an Advantage plan anytime. You can receive spiritual care at Arden, for example, under Part A, and that supplemental plan would pay all the costs, right, for a Medicare approved stay, Nancy?
Mhm. Yes.
And what I would say as far as the order of steps on something like that would be to look into the supplement first. We can
Right.
help with that. Apply for that, see if you're approved, and then
And then you
cancel
drop it.
the Advantage
That's
plan.
exactly right.
Don't cancel the Advantage plan first. I always like to have something in place
Right.
and approved before you cancel what you currently have.
Great. Well, thank you, Jim, Katie, and Nancy. These webinars are always very helpful. We had a lot of people sign up, and some were enrolled and some will watch later. So we're grateful. Please don't
Okay.
hesitate to call any of these three with Medicare or insurance-related questions at any time. They're happy to help. And obviously, from what we've seen, incredibly knowledgeable. Another resource you're welcome to contact is the Christian Science Provider Network, which works directly with Medicare and insurance companies on behalf of Christian Science care facilities, as well as individual Christian scientists. And this information will show at the end of this program. Also, financial assistance is available to Christian scientists of any age from the National Fund for Christian Science Nursing, or NFCSN. Contact information, once again, for these and other resources is listed at the end of today's webinar. Again, the point of this is that it's wise to be thinking through your options now. Before we go, I want to remind you to check our website, ardenwood.org, for details about upcoming webinar events. For instance, Christian Science practitioner Mike Muslin will give a talk on, quote, diving deep into the weekly Bible lesson, end quote, on Sunday, November 2nd at 2 p.m. Pacific. And once again, our annual Christmas celebration, what we invite to bring in the Christmas season, will be aired and shared on Sunday, December 7th at 2 p.m. We send invitations to all our events by email, and you can register online for each event on our website, ardenwood.org. Thank you all again for joining us today. Thank you, Katie, Jim, and Nancy, and goodbye for now.
Bye, everybody.
Bye-bye.
Bye.